So today's webinar is going to be talking about the behind the scenes work that help Black families thrive. And then our other presentation is going to be focused on collaborating for better doula data collection. We are joined by Alethea Carr from SemQuick, which is the Southeast Michigan Perinatal Quality Improvement Coalition, which is based in Detroit, or they're the Detroit Safer Childbirth City. And then we're kind of in luck today because we kind of have a 3 instead of a 2-for-1. I guess it's a 3-for-2, because we have Tulsa Birth Equity Initiative and SisterWeb presenting on their collaboration. AMCHIP actually gave out a collaborative grant for them to work on sustainability together, and what evolved was the doula data collection project. A reminder that we will have one more webinar next week. On the 8th, SisterWeb will be talking about their individual project in Black Women's Blueprint, which is based in Brooklyn. We'll also talk about their projects. Feel free to continue to introduce yourself in the chat. Say hello to everybody. One reminder is that we will have one presentation go, and then we'll have the next presentation go right after, and we'll hold space for all questions at the end, but feel free to put those questions in the Q&A and in the chat, and myself and Brittany will find them, and we will facilitate that Q&A. And to get us kicked off, we have Alethea presenting first. Alethea is a health equity consultant for the collaborative, specifically focusing on Project Detroit Voices for Life. So Ms. Alethea Carr is a native Detroiter who retired as a public health administrator and the former director of Michigan's Maternal and Child Health Administration at MDHS. Alethea is the health equity lead consultant to the Southeast Michigan Perinatal Quality, missing a letter, collaborative, so sorry, and works to improve the perinatal health system through improvement of equity in health services and birthing outcomes. So Alethea has worked as a public health consultant to a variety of states and national organizations since her full-time retirement in 2013, with a focus on addressing health equity in perinatal care by recognizing the impact of social determinants that impact health. Alethea serves on several boards of directors, including Kids Health Connection, a community-based agency providing health support services to children and families in the Tri-County area, Oak Village Cares, a community development corporation in Detroit. Alethea has a master's degree in business administration, is a registered dietitian, and a former food and policy fellow of the W.K. Kellogg Foundation. She is a wife and a mother to 2 adult children. So I will pass it to Alethea to do her presentation. Oh, Alethea, you're on mute, and Brittany is pulling up your slides. Yeah, just give her a second.
Yeah, I just said thank you, Giannina, for that introduction, which probably took up about 10 minutes of my time, so I'll keep it short. But if you will put my slides up, I'm really pleased to be here this afternoon to share the work that we were able to accomplish and then share with our community through the support of both the Merck Safer Childbirth Cities grant as well as from the sustainability grant. While the slides are coming up, I'll just mention that I'm one of 3 co-leads for SemQuick. I have 2 partners, Vernice Anthony and Dr. Iris Taylor, that help to administer the work that we do in our quality collaborative. The actual coordinator of Project Detroit Voices for Life was Princella Graham. Are you having trouble getting up the slides? You can pull them anytime. You can go to the next one. We SemQuick started in 2015. You can go to the next slide. This is a picture of my colleagues. And SemQuick actually began in 2015. We're one of 9 perinatal quality improvement collaboratives in Michigan that is supported by our state health department as a means of having community level connection to improve maternal and infant health. Our region includes 3 of the most populated counties in our state, which are Wayne, Oakland, and Macomb County. We have more than 40% of all of Michigan's births in these three counties, and more than 60% of all Black and Brown births in our region. So obviously, as our region goes in terms of maternal and infant health outcomes, so goes the state. Our mission is to create a coordinated, equitable, sustainable perinatal system of care that improves maternal and infant health outcomes. And we have a special focus, a particularly intentional focus on health equity in order to change the disparate outcomes that we continue to have. I've included our website link for you. I really invite all of you to take a look at it, as well as our email link, and ask you to like us on Facebook. We do have a Facebook page. You can go to the next slide. In terms of the Safer Childbirth Cities project, as I said, it's called Project Detroit Voices for Life, and we took a unique approach by working with existing agencies in our region that were authentically trusted and connected to the community, had a history of success with the work that they did. And you see the four partners that were part of this project. Henry Ford Health provided implicit bias and respectful care training for their maternal health providers and staff. And by that, I mean all of the staff that were involved with any maternal health services, from the receptionists to, and not only the docs and nurses, but everyone else that might touch a patient. Black Mothers Breastfeeding Association offered community doula training and had 3 classes graduate during the time of our project, graduating more than just under 30 doulas as part of that training. Sister Friends Detroit, which is part of the Detroit Health Department, Focus Hope, and BIMFA, all 3 worked together to recruit more than 100 women for maternal journey storytelling and recording. And that really generated a campaign that came from the work to lift the voices of Detroit women that we call Hear Us, Our Voice, Our Births, Detroit Mothers Speak. And you'll hear a little bit more about that as I go on. And then the Detroit Health Department initiated a local level maternal mortality review initiative that had a vitality component. We actually called it MMVRT, Maternal Mortality Vitality Review Team. I've included the direct link to the videos that came out of the work of our storytelling aspect, and really, again, encourage you to take a look at it. We have all of the videos posted. I think you'll find them very interesting. Next slide, please. In terms of definition of sustainability, I think commitment to continuation really says it all. We used the sustainability funds to conduct a summit on October 26th, and that should have been changed to 23. I got ahead of myself. I revised one version of these slides anyway. I guess you didn't get the right one. And so it was a day-long summit running from 8 to 4. We served breakfast. We had lunch and a light snack a couple of hours before we ended. We held the summit at Focus Hope, which is a trusted agency, well-respected, known to the community, had great parking. And as I mentioned, the Hear Us, Our Voices, Our Births campaign really was highlighted. This is one of the actual introductory slide that we used at the summit. We used the campaign logo on T-shirts that were given to everyone that attended, as well as posting that same logo on the swag bags that were that held the donations that our partner agencies and other agencies in the community contributed to the summit. We used the summit to allow the partners in a panel forum to actually talk about the work they had done over the last 3 years and, highlight the journey as well as the lessons learned and talk about next steps following the end of the funding cycle. We had over 180 people that participated. Actually, there were more that wanted to register than our location was able to hold. So we ended up having to turn people away. And I think because this was an in-person meeting, one of the few that has been held since we kind of coming out of the COVID pandemic, people were really excited to come together. As a result of the work that happened in the summit, and I'll talk about some of the particulars a little bit as we go on. We had connections that were formed. We had funding that was made available to several of the partners to continue some of the components of the work that they had done during the Safer Childbirth City initiative. And we actually had one of our agencies to receive funding from the Office of Minority Health for a community maternal support services grant, 4-year grant, which included several of the partners that were part of this work. And I notice Angel is on the webinar, which is good. She's one of our members of one of our partner agencies. During the summit, the panelists, as I said, shared their experience in the 3-year journey. We also had 360 pictures as a fun way. If you've heard of that, that's where you turn around in a circle while your picture is being taken. But we use that kind of fun activity as a way for people who made new connections at the summit to take a picture together and have that as a memory. Next slide. Part of the, before I go to this, I do want to mention part of the summit agenda included time for the participants to hear and reflect on the information that was shared during the summit, during the panelists' presentations, and then take that information and digest it in a way to identify what they might be able to do within their agency or what recommendations they had for SimQuick to put in place in the future to make sure the progress we had made with the initiatives would continue. Some of the challenges that I reflected here to sustainability really related to both to two of those areas that were noted in the next slide. But anyway, in the information that was provided, one had to do with stable funding streams. And I think it's important to note that system change is required to assure stable funding streams for this kind of work and consistency. And often advocacy, which is so important and came out as part of our work, is required, but often is not funded. And then the other aspect was organizational characteristics, including changes to the structure or the resources or climate, and where government agencies are involved, like the local health department or state health departments, or even county health, any organization that really has that governmental structure as part of it. You often see slow contracting processes, which affects spending the funds that you have. And that, we dealt with that throughout the course of this project and continued to reflect on how that type of process really needs to change. There also, when you work with partnerships, there's going to be philosophy differences. And sometimes, that will generate some cross-agency tension. And you need time to work together to understand what is creating the tension and really get to yes on all sides. So I think that has to be reflected as well as you think about sustainability. Next slide. Yeah, this is the graph that I was mentioning. Um, I really, because of the work that we were involved in, really all of the other areas were a challenge to us. As I said, the agencies had a positive reputation in the community and were well used by residents of the area. So that didn't pose a problem in terms of program adaptability. I think the experience that we had during our 3 years of funding really reflected the pliable adaptability of our agencies. You know, the work that they were doing was on top of their normal work. And so, you know, that posed a challenge, but all of the partners were just so engaged and ready to do whatever it took to put Project Detroit in place and offer suggestions for changes that we needed to make along the way, you know, that reflected a little different approach than what was originally written in the grant application. And then in terms of contextual and environmental fit, because all of these agencies were part of the Detroit community, they were really well positioned to meet the needs of the residents that were using their services. And we held monthly meetings with our partners that really facilitated communication across the partnerships, even though most of our partner agencies were familiar with each other. They really bonded, I think, in this project and became even closer in terms of their working relationship as well as some outside relationships, you know, as a result of the work we were doing. Next slide, please. The sustainability grant, as I said, supported the cost of the summit. We had t-shirts. Actually, I do have, I don't know if people can see me, but this is the t-shirt. Uh-oh. Yeah, this is the t-shirt that was given to all of our participants within the swag bag. And on the back, we actually had sponsored logos included, which, you know, helped to promote the agencies that wanted to be sponsors. Um, the swag bags included not only the t-shirts and donations that agencies provided to us, but we were able to purchase a book by Linda Villarosa called Under the Skin for everyone that attended. And this book was talks about the hidden toll of racism on American lives and on the health of our nation. So that was a great takeaway um, for our participants. We also were able to tape segments of our speakers, which we've now posted on our website. That's really why I'm encouraging you to take a look at it, because it gives you a chance to see and hear some of the information that was shared, as well as allow those that participated a chance to look at the presentations again, you know, if they wanted to share it with folks that weren't able to make the summit back at their office, they're able to do that. It allowed for community input for future programming. We actually had uh, intentional table talks that allowed the participants to come together and kind of rehash what they had just heard in the panel presentations and talk about what it meant for their work within their organization or within their sphere of influence, and what else needed to happen to continue it. I mentioned the sponsors that were able to, that wanted and were able to be engaged through the summit, we found that our Medicaid health plans were really interested in being part of the summit. We even had to turn some away because it was just too late. We didn't, it was just too late to be able to either add them to the t-shirt or add them to the slides so that we could be sure to mention and give credit to all of the sponsors. But I think it also allowed us the opportunity to engage with the representatives of the health plans for the next maternal health summit that was encouraged through our evaluations and is now planned as an annual event that will be administered by SimQuick. The sustainability grant also supported information exchange with new doulas. We were able to provide funding to Black Mothers Breastfeeding Association, and they held a separate event that allowed new doulas, and I say new doulas because Michigan had a law passed last January that allowed our doulas to be reimbursed by Medicaid. So, along with the training that BIMFA offered to certify new doulas, we had now a funding stream, a Medicaid funding stream at least, that doulas could use to get reimbursed for their services. So we had a new pool of doulas that needed to talk about some of the issues that they were experiencing as they worked to provide services as a doula within the community. And then we also provided funding to the Detroit Health Department to support staffing for chart abstraction and for needed equipment that would be used with the maternal mortality and vitality review teams. Really to enhance that work, they wanted to do some family interviews, which was a newer aspect of the approach to this work. I included the slide that we used at the summit to thank our sponsors, just to give you a sense of who helped to sponsor the summit along with AmChip. Next slide. I talked about the intentional way that we had our summit participants talk about and reflect the information they were hearing from the panelists. We used a process called ORID, which is objective, reflective, interpretive decisional process. And that's a facilitated process that really led to fruitful discussion for our sustainability plan. I've listed some of the things that came out of those table talks, if you will. They talked about the need for advocacy, communicating, giving facts, accountability, the power of storytelling, which was a huge component of our work, and including doulas in the perinatal health team, as well as recognizing change opportunities, because it was real clear that some of the processes, some of the approaches needed to change within our community. We took the information that came out of the ORID process and had it on Post-its, and then had large posters, I guess you call them, across the room, and put them up so people could see what was coming out of the various table talks. And our evaluators were really supportive in summarizing all the information that came out of those table talks, and then sharing that both with SimQuick, which we're using to guide our planning for this year and beyond, and also shared it with all of the participants that were at the summit after the summit was over. Next slide. In terms of measuring success, I put this at the top because to me, this is always a good sign that you're having a good meeting. Most of the summit participants stayed until the very end. And that, as I said, our summit started at 8 and ran until 4 o'clock. We fed them. It just happened that the day we had the summit, it was unseasonably warm day. And even though it was in the fall, like I said, it was October, the air conditioning had been turned off at the facility. So there was some, uncomfortably hot times during the meeting, but people still remained and stayed engaged. We had an evaluation that was provided to our participants, and the results of the evaluation indicated an overwhelming agreement that the meeting was very useful. And as I said, they wanted to see it happen every year. When we had the table talk sessions, which were weaved into our agenda, there was active discussion and participation throughout the summit. And connections were made. I mean, we could see people exchanging business cards and exchanging contact information. The investment that happened for fiscal year 2024 really, to me, was another major indicator of the success. SimQuick was able to actually get some additional funding from the state health department, and we used that to provide contractual support to all of the all of the agencies actually that were part of the summit to continue the work that they'd done as a part of this project. And then I mentioned the federal grant that BEMFA and Henry Ford Health applied for as a joint effort and were successful in receiving. We'll be watching the maternal health outcome data for improvements, as we begin to receive the data that will reflect the time period of our project, just to see if changes happen in the right direction. And we held a meeting, it's been about 2 weeks now, of all of our partners as our close out to the project, if you will, luncheon meeting, and actually talked about what reflections they had on the effect of being a part of this project. And all of the partners discussed their deeper understanding of health equity, as well as the value of partnerships in doing the work that we do around perinatal service delivery. Next slide. So what do I hope will be different? Well, I hope the many of the efforts and initiatives that have come out of this work will continue. Those suggestions that were made will be put in place, and that our perinatal system of care will truly, authentically embrace the value of doulas, community health workers, and peer breastfeeding counselors as an essential part of, if you will, of the perinatal care team. I also hope to see that education will increase for our medical providers about implicit bias and the mitigating solutions that can be used, along with respectful care becoming the standard of care in our community. Michigan has a requirement that all licensed professionals take an implicit bias training during the year as part of their licensing process. And we recognize you need to go beyond that. And so I really hope that will be the start, but I hope that will continue to raise the level of understanding and change that we see related to implicit bias. Also hope that advocacy for evidence-based interventions will increase. As I said, we often don't see funding that actually supports advocacy, and recognize that's a big need. And then the storytelling aspect of our work certainly pointed to the importance of community stories being heard, being shared. And I think if they become a fundamental part of all policy change, we'll see policies that will be more reflective of the needs of the community in a way that they embrace and can access. And then, as I mentioned, the annual Maternal Health Summit. SimQuick has been committed to offering that on an annual basis. We're making budgetary plans for that now. And as I said, we had sponsors that are interested in helping to make that happen as well. Last slide, please. So in conclusion, what external factors are involved in our sustainability? Well, I mentioned the increase in funding that came to SimQuick. We want to see that continue. There's no guarantee that SimQuick will be funded at this level for 2025 or 2026. And so looking at ways to make changes within the organizations that support the work so that it continues will be important. And in terms of what will accelerate our success, broad publicity of the work that Project Detroit Voices for Life has done as a model for promoting maternal health outcome improvement. And again, I've included our links. I encourage you to take a look at them. We do have some of our partners planning to attend the AmChip conference. And so, that's another way of keeping that connection to the work and the partners across the country that are involved in this. We've also been interviewed by BirthWorks as an episode for their coming podcast. I think that's going to be available later this year. We promote our website broadly, but I share it with you. I think we've got over 30 people on this webinar. Please take a look at it. Like us on Facebook. Take some time to look at those videos that are posted from the women of Detroit that talked about their experience in the perinatal system. And with that, I think I'll stop and turn it over to my colleague. Thank you again.
Thank you for that. It's great learning about that. Next, I'm going to introduce, Allie, can you pronounce your last name for me? I don't want to butcher it.
Sure, it's Ali Cuentos, and you can do short intro. That's fine.
Okay. I am going to introduce Allie Quintos from SisterWeb. Here is her bio. So short and quick, she's a mom, daughter, sister, partner. She is also one of the founding members of, she is a founding member of Community Well, a holistic family support center in the neighborhood of San Francisco. Along with Marner, she is one of the co-founders of SisterWeb and currently serves as Director of Evaluations. Allie has supported 500 births, mentored dozens of new doulas. Prior to finding her calling as a birth worker, Allie designed curriculum, coordinated early education programs serving immigrant families, as well as taught in public schools and preschool settings. I'm also going to introduce, and I think I'm saying your name right, Hannah Ralston.
You got it.
Tulsa Birth Equity Initiative. So she is a hospital quality improvement officer. In her role, she gets to spend her time on all things data, as well as sustaining hospital and clinic partnerships. She's a graduate of Oklahoma State University. She brings a decade of program management and process improvement. She also trained as a doula through TBI and served on the policy committee for the Coalition of Oklahoma and Breastfeeding Advocates. And I am going to share their slides so they can get started.
Excellent. Well, while Brittany shares our slides and get those pulled up, I'll go ahead and kind of kick us off just with the intro of our organizations. We are presenting on our collaboration grant through the Tulsa Birth Equity Initiative and SisterWeb San Francisco Community Doula Network. So I think we are a little bit unique in that we, I believe, are the only collaboration grant that will be presenting. So we had the opportunity to partner, and while Allie and I are the ones, if you go to the next slide, we are presenting today. We are both surrounded by really fabulous teams of people that make our work possible. So Allie and I are often in the office doing sort of back office work, and so much respect to our doulas, to those who are in the community who are doing the work that we get to report on. So I want to just share that without them, our work doesn't exist. So kudos to all of our doulas on the SisterWeb team, on the TBEI team, the ones who are really doing the crucial work of maternal health improvement. So if you go to the next slide, we have a lot in common as organizations, as SisterWeb and as Tulsa Birth Equity Initiative. So I'll let Allie share a little bit about the mission and kind of where you guys stand now.
Thank you, Hannah. Yes, and a shout out, honestly, to everyone here today. It's an honor to be with y'all. Alethea, I felt like I was giving myself a neck ache, nodding vigorously to everything you were saying. So thank you to AmChip for creating these spaces where we can come together and engage in some peer-to-peer learning. I wrote down, I have a notebook, old school, with all the notes from your presentation. So SisterWeb in San Francisco, we're located in the southeast of the city in a historically Black neighborhood called the Bayview Hunters Point. And about a third of our clients are located in our neighborhood. We provide really two different services. We provide culturally congruent doula care, very high touch model of staff salaried doula care to Black birthing families here in the city. All of our doulas are from the community, and currently half of our staff are former clients. So we're really building a workforce from within the community. We also provide that professional home for doulas. So we know that a lot of other models of care, when I first became a doula, it was all about volunteer programs, and it was a lot of white doulas volunteering in the community, and there wasn't really that culturally congruent peer-based care. And a big part of it was because who has time to volunteer and who has the ability to, not show up at their job to attend a birth. And so we really built SisterWeb to be that secure salaried income that people can count on. We are, looking at doula work as, for some people, a pathway onto other careers in healthcare. We've had doulas leave our employment and go on to nursing school. We even have one of our doulas who's in a doctoral program of nursing right now at the University of Washington, and we're so proud of her. So we're looking at it as a workforce development program. And then our additional organizational goal is to work within a movement to dismantle racism in healthcare. And so much of, Alethea, what you shared in your presentation, we work with hospital systems, we work with other community providers in the city, having those courageous conversations about how we can show up in partnership and really make that world where all birthing people can feel safe and respected and birth with dignity a reality. And I'll pass it on to Hannah.
Yeah. So just as Allie said, TBEI shares a really similar mission just in Tulsa, Oklahoma. we provide doula support and services at no cost to Black, Native, Latin teen parents and those who are navigating substance abuse or recovery, as well as those who are justice involved through community-based doula support. So our doulas on staff are of and from the communities that they serve, and we are also working on some other programs to be able to build those hospital relationships, have those, as Ali said, courageous conversations, and really reduce those maternal health disparities where they start, knowing that doulas are only part of that solution. So similarly, since we started in 2019, we've supported 373 families with no cost doula support, where SisterWeb has recently had some reduction in some staff, but has been able to support 482 families. If you'll go to the next slide. As we thought about these sustainability domains, we really thought about these in terms of what are the highlights and what are kind of the challenges that both of our organizations face. So if you go to the next slide, you can see that as we think about continuous improvement, we realize that there is this challenge of getting real-time actionable data. But that opportunity and that highlight is the collaboration project, which we'll talk more about in just a second, where we really came together using some of SisterWeb's framework that has been developed and shared on collecting data that really matters and utilizing that for TBEI. Obviously, the highlight of both of our organizations is providing that really high quality, high touch, community-based doula services that are really meeting the needs of the families that are served. In terms of funding, I think funding can be a continuous challenge for many organizations working in this arena. But the particular challenge that I think feels very salient and timely for SisterWeb is some of their contract reductions, which, as I mentioned, have also resulted in some staff layoffs and ultimately being able to serve fewer families and fewer people than they have served in the past. When we think about our organizational characteristics, I think the thing that I do want to just highlight is this really strong culture. So obviously, Ali said, most of their doulas on staff have actually been clients themselves. And as TBEI, we provide doula training as well. So all of our staff doulas have been through our TBEI training and just have a really strong culture and living our values day to day. When we think about kind of being able to be adaptable, this is definitely a trade-off here. We see that we have both organizations have been somewhat forced to be adaptable just due to changing landscapes and changing funding. But this can sometimes come at kind of the payoff or the negative side of not being able to necessarily focus on our long-term strategy, or maybe going in directions of funding versus doing what is best for the organization. So being able to kind of follow funding rather than really stick with a long-term strategy. And then I think as we know, when we think about our context of environment and what it looks like now, just the political landscape can be a challenge, particularly here in Oklahoma, knowing everything that is happening for reproductive health. And Alethea, when you mentioned that it is a requirement in Michigan that healthcare providers do a racial equity training and it's not enough, we have our state legislators who are trying to legislate against anything like that happening and against diversity and inclusion being taught in schools or even our correct history. So we know that the political landscape is a really unfortunate place nationally and particularly here in Oklahoma. But one thing that we want to highlight is just that national recognition of doulas. We've been seeing an increase in news stories, an increase in kind of the recognition of the importance and the value of doulas. We see that somewhat through doula Medicaid reimbursement. Again, that is something that is becoming much more widely available across the United States and is available in Oklahoma, though we have yet to officially access it, and available in California, although I know that SisterWeb is in a similar position. And then when we think about kind of those active and partnerships and relationships and collaborators, I think SisterWeb and TBEI are both really fortunate to have lots of local partnerships that are strong, that help us to do our work and serve clients best. But I do also want to highlight a national partnership that Ali has really spearheaded and been a leader on, which is the Doula Data Consortium. So a group of doula serving organizations that are coming together to discuss challenges, understand some of the metrics that we need to be measuring, and develop some common goals and understanding, and really being able to come together to advocate for policies that are going to affect doulas long term. So if you go to the next slide, all of that is really about our organizations all together. But our collaboration grant really focused in on this data piece and running a data sustainability pilot. So using SisterWeb's knowledge, expertise, and software for data collection and reporting. So when I think about collaboration, this is something that this quote really resonates. If you want to go fast, go alone. If you want to go far, go together. So when we think about kind of TBEI and where we were, we had been using a data system that was originally designed for midwives, not designed for doulas. We've been using it for a long time, didn't have a lot of flexibility in what was produced or entered. And this really all started about a year ago when our executive director happened to be on a call with Ali about something totally different. And Ali just mentioned, we have this great data system that we use. And we thought, let's hear more about it. And that really started us on this journey to where we are today, which is to utilize the Clear Impact software as well as kind of the framework that is developed by SisterWeb and supported by Clear Impact to transition our data system and see what it would look like to bring on additional organizations. So in the term of the grant, we have successfully brought TBEI onto Clear Impact. We had a soft launch in December and officially launched in January. And I can't say that it is, perfect and without any challenges, but we are able to work through those challenges. We've heard from doulas that this is saving them time, it is saving them effort. We really took so much of what SisterWeb has done of really putting those frontline workers in control of what data is being collected, and giving them really a say in what's going to work best for how that's entered. So even some really simple things of like, should this be a drop down or should this be a checkbox, can really be some of those things that are going to save time, save that mental energy. If someone is just attended a birth for 40 hours, let's make this as quick, as simple, as easy as possible. So bringing TBEI onto Clear Impact and thinking through and creating a framework for bringing on additional organizations is kind of what we have been doing during the term of the collaboration grant. And one of our intermediate goals is to present at the AmChip conference in April. So Allie and I and some of our other team will be presenting. If you want the longer version of this and know how to do it yourself and get some tips and tricks, please join us. And so we want to be able to recruit and onboard other organizations, knowing that this will continue cost savings with those additional organizations, will allow other doula serving organizations to get some of that low cost, real-time actionable data and be able to really join us in knowledge sharing and some joint metrics to, again, really be able to push the advocacy and policy for not just doula and Medicaid reimbursement, but paying doulas that living wage that they deserve as a valued member of the birth team. So I'll turn it over to Allie to go into a little bit more about that framework. And I know we're running short on time, so then we'll wrap up. So next slide, please.
All right. I'm going to keep this really short because I know we do want to have some time for questions. The biggest thing, because everybody can read what's on the slide here, hopefully, or look into it later, that I would say is like the driving force behind our collaboration is thinking about data practices the same way we think about doula care. Right? We're slow, we're intentional, we're thoughtful, we're values based. So having actual like a philosophy or a framework around it, I think is just the most critical part. And when Tulsa approached us and said, can you help us migrate our data and use a different data system, it was like, okay, first question, what are your values about data collection? And when we think about SisterWeb's values around data collection, we developed these 3 Ps. It's kind of the SisterWeb stamp of how we do data, where we make sure that things we're collecting are purposeful. If we're not using the answers on a question from a client, please let's stop asking them. Like, it's rude, it's wasting their time. If the data points are not powerful, if they're not helping us advance our cause or are part of some advocacy, let's think about rewriting them. And then most importantly, like Hannah lifted up, getting our doulas who are filling out the forms part of the process of creating. So we call that our co-creation model. And it can be fun. When I came to Tulsa to do it, we used scissors and tape and just cut up all the forms and said, so what do you want on them? What order? Do you want to scrap this form? Let's scrap it. You want to make a new one? One of their forms, they actually divided into 2 to make them shorter. So these things that somebody sitting in an office like me, working from SisterWeb, we're not going to know these things. So really bringing the doulas into that process is so key. We hope that you'll join us at the conference for those who can make it, where we're going to make it much more of like a hands-on learning session. And just giving thanks for AmChip for being here.
Yeah, so we'll wrap up really quickly on this next slide. But basically what is next for us as we think about sustainability, I think it really goes to collaboration, and just this collaboration between SisterWeb and TBEI has led to other opportunities for collaboration in other areas of the work. And so all of these conversations that we have and presentations like this are so helpful in kind of sparking these ideas and looking into further things and understanding how we can best partner together. And then just kind of the accelerating success, I think diversified funding is definitely a challenge, and just want to again highlight some of the challenges that SisterWeb has faced. And again, knowing that Medicaid reimbursement is great, but sometimes it means it's not as accessible as we think it is, and it causes other major funders to maybe pull back, thinking, oh, Medicaid reimbursement is on the table. So just being creative on that front, and then the opportunity, join us on Clear Impact for improved data and reporting. So we'll tell you the background at AmChips since we only have 2 minutes, but I'd love to share more of that story if you guys are interested, and we can of course share exactly how that would work.
Fabulous. Thank you so much, Hanny. I put your names together, Hanny. Hannah and Nally, for your presentation. Yeah, I think that brings us close to time. Or if there's 1 or 2 questions, we can definitely answer them. And thanks for plugging your AmChip conference presentation. We hope that we'll see a bunch of folks there, and that you'll come to their specific, conference presentation. Are there any questions that we can answer? If not, there is a short poll that I would love for everybody attending to take, just so that we can see how this session landed with everyone before you leave. So if you could just take that quick poll, panelists, you're excluded from this poll. One last reminder is we have 1 more webinar session next week on Thursday, same time, same place. Feel free to join us. We'll be really excited to see you there.
Allie, thank you for putting your contact information in the chat. I'll be in touch. Very interested, yes.
Yay, I love it. Making connections on the call.
I got you. I already have your website pulled up.
Okay.
Thanks again for having me.
Thank you very much.
This was good.
Yeah. Thank you so much, Hannah, Allie, for all your time. I really appreciate everybody being here. I'm seeing around half of the people have taken my poll. I'm going to give them a minute or 2 to finish up because there's a couple of questions. Okay, perfect. Thank you, everybody. Have a great rest of your day. Happy Friday, Junior. Bye.
Thanks. Bye.